Hello everyone. Are you planning to get married in the near future or planning to get married later on? Today, I want to tell you the medical tests that you need to do as you prepare for marriage. Many times you don't come to us when you are planning your marriage. You go to the pastors, you go to the reverends, people who are not medical personnel. Now, today we want to tell you the details of the tests that you need to do as you prepare for marriage. Number one, you need to do an HIV test. The reason why you need to do an HIV test is because HIV is sexually transmitted, and you know, as you are planning to go for marriage, marriage is a sexual relationship. For you to prevent yourself from getting into marriage with a partner who is the HIV status you don't desire, you need to do that HIV test. Now, it is the most important thing in this is not even just the HIV test, but it's important for you to know that you need to do at least 2 HIV tests. Don't do one. Many times you're doing this HIV test at the last minute. You even do it a few days to the weekend of wedding, but that is not adequate. Why? Because the HIV tests that we do are not able to detect that someone has HIV if they contracted it less than a week ago. HIV has what we call incubation period, the period that it will take in the blood that these common tests will not detect it. So you need to do at least 2 tests of HIV. Do it one and do the second one after 3 months. After the second test, if both of them are negative, and you are quite sure that within the period of 3 months, your partner has not gone messing around and gotten exposure to HIV. With that second test, if it is negative, we are good. You can be sure that their HIV status is good and is what is reflecting. Number 2, you need to do hepatitis B test. We don't talk about this enough. Hepatitis currently in Uganda is a more ruthless killer. It is a more ruthless killer than even HIV. And its transmission is much higher. The chances of you getting hepatitis B from a sexual partner are much higher than getting HIV from a partner who has HIV. So meaning that we really don't want you to take chances with hepatitis B. Do hepatitis B test. We have many laboratories where you can do it. And once you do it and it is negative, it is quite good. But also, we are warning that if both of you have not vaccinated against hepatitis B and you test hepatitis B negative, kindly do the routine immunization of hepatitis B so that you are protected for the future. Kindly subscribe to my YouTube channel for this kind of information if it is helpful to you. We are on YouTube as BOBALE Healthlink Clinics Uganda. We are on TikTok as Birabiano Francis. You can also follow Juakali Doctor on TikTok. You will find us on those platforms and continue to get this kind of medical advice for free. The other test that you need to do hepatitis C test. Hepatitis C is also there. It is a ruthless disease, and it is the prevalence, or it is the presence in our areas are also increasing. We are seeing a number of cases with hepatitis C. So do your hepatitis C test, because it can also be transmitted through sexual intercourse, through sweat, and through close contact. The 4th test that you need to do, my friends, do a sickle cell test. And this sickle cell test, do not go for the preliminary sickling test that everybody is doing. The sickling test is not what you need when you're going into a marriage. What you need is HB electrophoresis, which is the genetic analysis for your for your sickle cell status, because you may be a carrier of sickle cell and your partner may also be a carrier, in which case you have a 50% chance of delivering a child with sickle cell. So it is quite important for you not to do the cheap sickling test of 10,000 and go for the HB electrophoresis of 70,000, because that marriage you're going in for life. You don't need to economize. You need to go for the real tests that are going to save you from problems that you will face in the future. Now, these ones are the major tests that you may need to do, but of course we have the other tests that you need to add. You need to test for syphilis, you need to test for gonorrhea, we need to do a high vaginal swab for your wife or girlfriend, for your partner. We need to do urinalysis to screen. We need to do calcium sensitivity on both your urines to be able to know exactly what is in the picture for within the sexual organs. And then the other things, this is a bonus. Do a scan. Do an abdominal ultrasound scan for your wife. You will be shocked. But we have had partners who have gotten married to their wives whose uteruses have been removed. Have you imagined that? The wife tells you, this mark you are seeing here, they did for me operation in the appendix. She conceals the matter to you. When you get married, 10 years down the road, no child, but there is no uterus. So the uterus will not grow back. Get me clearly, things are happening in Uganda, and we are seeing these cases in the hospitals where the partner, because of course they know the kind of partners they are going for. Someone is dating you maybe because you are financially very well off, and they have done messes in their previous life. They have done a lot of abortion. Maybe one went bad and the uterus was removed, but someone is not opening up to you that I don't have a uterus. Do a scan of 30,000 to ascertain, to be sure that the woman you are marrying actually has a uterus, because others may not have a uterus, So do that, So those are important. Those are important for you to do. So kindly subscribe to these channels for more information. We shall be giving you a lot of this for free. My name is Dr. Bale. I am a medical doctor practicing in Uganda. Within Tororo municipality is where I run a medical center. But I also have a digital platform where I offer consultations online for patients who want to see me from Kampala. I can see you from Tororo. Through that platform, we can do a video consultation. And then in case I need tests, I have laboratory partners whom I can send to pick your laboratory samples from where you are, and I give you a prescription. Thank you very much. Kindly subscribe if this information was important to you.